Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Mukesh Bang with us. Dr. Mukesh Bang is a renowned consultant medical oncologist and hemato-oncologist in Nagpur and is currently practicing in Alexis Multispeciality Hospital, Nagpur. For the past 6 years, he has worked in this field. Welcome to Medicircle, Dr. Mukesh Bang.
Thank you very much.
So, ovarian cancer is the third most common gynecological cancer in Indian women. The most common gynecological cancer is breast cancer, followed by cervical cancer. Ovarian cancer was estimated to be the third most common cancer among Indian women and 8 overall as per the Globocon 2018 fact sheet. So consulting 3.44%, that is 36,170 approximate, of all cancer cases, a woman's risk of getting an ovarian cancer during her lifetime is about 1 in 78. So doctor, can you please tell us what is ovarian cancer?
So basically, in females, in the reproductive organs, the eggs are generated by the ovaries. So in these are the where both ovaries they are the organ for the production of the eggs. So where the cancer develops, that is an ovarian cancer.
And what are the early warning signs of ovarian cancer?
So I think in ovarian cancer, most of the time patients comes in a locally advanced or advanced stage. In early stage, there are no signs and symptoms. That's the reason ovarian cancer incidence is more in a stage 3 and stage 4. Only accidentally, if we are doing any ultrasonography for any other reason or any other trouble and you find something in the ovaries, then only you will be able to detect early ovarian cancers.
So doctor, can you tell us about the main causes of ovarian cancer?
The most commonly advanced age, elderly population, most common reason. Other than that, family history. If there is a family history of breast cancer, ovarian cancer, all colon cancer in the family, there are some familial syndromes which runs in the families. Those are at high risk of ovarian cancer. Other than that, some gene mutation, just like a BRCA gene mutation. These are very common mutations which can cause breast cancer and ovarian cancer. Other than that, morbid obesity, these are sedentary lifestyles, then use of postmenopausal hormone replacement therapy. These are some of the other risk factors which can cause ovarian cancer.
So what are the effective treatments for ovarian cancer?
First of all, you need to understand what is the stage of the ovarian cancer. So as per the stage and as per the disease burden of ovarian cancer, we treat. Sometimes if the patient is having a stage 3B or C disease, but it is operable, yeah, we in our medical term, we mention as a optimal cytoreduction, where we can completely remove the tumor, what we can see microscopically by the vision. So if it is possible, we try to do the surgery first. Otherwise, if the patient is having fluid in the abdomen, fullness in the abdomen, ascites, we mean to say ascites, fluid in the abdomen, then we try to give chemotherapy first. That is called neoadjuvant chemotherapy, where we give chemotherapy first and try to shrink the fluid and the tumor size. And then after 3 or 4 cycles of chemotherapy, when the tumor responds, when the clinical condition becomes better, we hand over to the surgeon and tell them to do a cytoreductive surgery. And after that, the remaining chemotherapy, remaining 3 or 2 cycles of chemotherapy, we finish. And in advanced stage 4 disease, even if it is an advanced stage 4 disease, there is a still hope for surgery after chemotherapy, depending upon the response.
Okay. So how can one avoid ovarian cancer?
So I think the predisposing factors like obesity, sedentary lifestyle, use of hormonal replacement therapy in the daily population, these are some of the risk factors which you can avoid. Other than that, if any family member having breast, ovarian, colon, rectal cancers, so then they can screen for genes. And if the genes are positive, like BRCA gene are positive, then they can do the prophylactic surgery and can avoid the risk of ovarian cancer. Other than that, there are some screening tools, but they are not yet been approved by many governments, but still CA-125 and sonography of the abdomen, these are some of the basic screening modalities, but they have not yet been completely approved by many of the companies, many of the governments. So there are no straightforward screening guidelines for ovarian cancer, but doing ultrasonography of the abdomen and just doing the CA-125, these are some of the tools to watch for ovarian cancer.
Okay. So at what stage does ovarian cancer is fatal?
So I think stage 4, automatically in any stage, see, I mean to say, if you are talking about in India, so any stage ovarian cancer or any world cancer at any stage is a fatal cancer. But if you treat properly, if you stage properly, then nothing to worry. But if the stage 4 ovarian cancer is there, there is a high chances that even after treatment, disease can come back. And then we have to use different modalities of treatment, different chemotherapy regimens. Newer antibodies are there, newer oral tablets are now FDA has approved since last year. Oral tablets have been approved, which we can use in females after chemotherapy and can continue maintenance therapy.
Okay, doctor. So on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question answer session in which you could either answer in yes or no, or a 1 or 2 line sentence will also do.
Okay.
So doctor, my first question is that at what age is ovarian cancer starts?
So most commonly 55 to 65 is the age group. But if the genetic predisposition, family history there, it can come early.
So can ovarian cancer happen suddenly?
There is, I think this may not be a right question, I can say, because it is not suddenly. But what happens if the patient having fullness, abdominal fullness, usually they show to the gastroenterologist or physician, and or they take the acidity medications and all those things. But later when they evaluate by sonography and everything, they understand that something is going wrong.
And is ovarian cancer completely curable?
So in early stage, it is completely curable. Even if it is in a stage 3, it is completely curable if we treat properly. But stage 4 cancer, definitely we don't use the word curable, because these patients need multiple lines of therapy. They are in good control of the disease with newer drugs, but still we don't use the word cure for the stage 4 ovarian cancer.
And is ovarian cancer painful?
Definitely, in locally advanced stage, it is painful because it called abdominal distension, back pain, lower back pain, pelvic pain. So it is painful, not in terms of only somatic pain, but physical, mental, psychological pain also is included as a pain part in ovarian cancer.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you very much.
Thank you.